Hi, I am Dr. Arsalan and today we are going to discuss about an important organ of the body, the spleen. In this lecture, we will cover the anatomy and physiology of spleen, or structure and function of spleen, its location in the body, blood vessels and the nerves innervating the spleen, the important functions of the spleen will be discussed here, and the medical conditions associated with the spleen. Spleen is the muscular and ductless organ. It is made up of smooth muscles without having any duct or secretions. So it is situated in the upper left abdomen above the stomach as it is shown in the diagram. This is the stomach and the spleen is located on the upper left of the stomach. This is the spleen. It is lying just above the stomach and below the diaphragm. It mainly performs the functions of blood filtration and immunity. So it is associated with the filtration of blood and an important lymphoid organ. Now we will discuss the location of the spleen. Spleen is located in the upper left of the abdomen. This is the abdominal cavity in which spleen is located on the upper left of the abdomen just above the stomach. This is the esophagus leading to the stomach, and on the right side of the body is liver, below which is gallbladder. If we assume this line as a demarcation between thoracic and abdominal cavity, and if we assume it as diaphragm, so the spleen is located just below the diaphragm. Occurrence: spleen is singular and unique organ in the body, and it occurs in all sorts and types of vertebrates. The size of the spleen is variable. It varies from individual to individual. However, as an average, it is 3 to 5 inches long, and the weight of spleen is 22 to 30 grams. Protection: the spleen is protected in the rib cage. It lies just below the diaphragm and is covered by the left rib cage from 9th to 11th rib. Moreover, the spleen is enclosed in the peritoneum. So this is the protection of spleen. The spleen bears two surfaces. One is gastric surface, the second is renal surface. As it is shown in the diagram, the upper or medial side of the spleen is directed towards the stomach. This surface is called gastric surface. And the downward surface of the spleen, it is directed towards the kidneys. So this is called renal surface. So this surface is called gastric surface and this surface is called renal surface. So the spleen bears two surfaces, one directed towards the stomach and the other directed towards the kidney. The surface which is directed to the stomach is called gastric surface, and the surface which is directed towards the kidneys is called renal surface. Spleen is firmly attached in the body in a fixed position by two ligaments. These ligaments are gastrosplenic ligament and splenorenal ligament. As their names indicate, the first ligament which binds or joins the spleen to the stomach, this is called gastrosplenic ligament, while the ligament which joins the spleen to the left kidney, it attaches the spleen to the left kidney, is called splenorenal ligament. So these two ligaments make the spleen firmly attached in the body in a fixed position. So these were the attachment sites of the spleen, the two ligaments, gastrosplenic ligament and splenorenal ligament. Next is the vasculature of the spleen. The arteries which supply blood to the spleen are called splenic arteries, and the veins which drain the blood away from the spleen are called splenic veins. For example, this is the spleen, and the arteries which are going to the spleen, these are called splenic arteries. So we will see their origin. The main aorta, the abdominal aorta, splenic artery. So the abdominal aorta give rise to celiac trunk, and this celiac trunk give rise to splenic artery. The purified and oxygenated blood is transported to the spleen from the abdominal aorta to the celiac trunk and then splenic artery. Then the deoxygenated blood is returned back to the venous supply by splenic vein. This splenic vein combines to form mesenteric vein, which drain into hepatic portal veins. So the route of blood circulation across the spleen is the abdominal aorta, which give rise to celiac trunk, which give rise to splenic artery. Then in the same way, blood is drained off the spleen via splenic vein into mesenteric vein and hepatic portal vein, which supply this deoxygenated blood to the main vena cava. The nerves supplied to the spleen constitute splenic plexus. So the nerves which innervate the spleen, these are called splenic plexus. And the spleen is controlled by the nervous system through this splenic plexus. This splenic plexus then joins the vagus nerve. Vagus nerve is the largest nerve of the body, running bilaterally. It starts from the medulla oblongata, running through the jugular foramen, through chest and abdomen, and give rise to splenic plexus, which innervate to the spleen. Although spleen is not a vital organ, however, it plays an important role in the body. There are 5 important functions of the spleen which we will discuss in this lecture. First one is filtration of the blood. Spleen acts as filter of the blood and it filters out the old, damaged, worn out RBCs which have completed their 120 days lifespan. These RBCs are damaged or broken down by the spleen. The spleen consists of macrophages, a kind of blood cells, which break these RBCs. The macrophages are present in the spleen, which break and recycle the old, damaged, and worn out RBCs after their completion of lifespan of 120 days. And these RBCs, when these are broken down, hemoglobin is released, out of which iron component is recycled. The iron is recycled in manner of ferritin or bilirubin and returned to the blood circulation or liver. So here the destruction of RBCs occur, therefore spleen is also termed as graveyard of RBCs, the graveyard of red blood cells. This is the common synonym of the spleen, the graveyard of red blood cells. This was the prime function of spleen. Second is storage of cells. So spleen stores white blood cells as well as platelets. These both kind of cells are stored in the spleen. Next is storage of blood. Spleen can store up to 240 ml of the blood as reserved volume, and it releases this blood at a time of need. For example, in case of severe bleeding, in trauma, menstruation or surgery, when there is hypovolemia or the blood is lost, spleen returns this 240 ml of the blood back to the circulation of the body to maintain the vitality of life, and survival is made possible by this reserved volume. Spleen acts as lymphoid organ. It is important lymphoid organ as it produces lymphocytes, and these lymphocytes are important for the killing of infectious agents entering into the body. So this is an important lymphoid or immune organ and plays an important function in the immunity. Spleen also plays important role and it synthesizes the blood cells during fetal life. All kind of the blood cells, for example, erythrocytes, leukocytes or thrombocytes, these are synthesized during fetal life by the spleen. Now we will discuss important medical conditions of the spleen. First one is splenomegaly. This is the enlargement of spleen either due to inflammation or infection. In some type of cancers or leukemia, the spleen also enlarges and is referred to the splenomegaly. Next is the splenic injury. It refers to the rupture of the spleen due to accident or trauma. When the spleen ruptures, reserved volume of the blood stored in the spleen is released into the body in the abdominal cavity, forming hematoma, and it is fatal. Therefore, splenectomy is recommended here. Splenectomy is the removal of spleen from the body. This is a surgical procedure in which the spleen is removed from the body. Next is asplenia. Asplenia means non-functioning of the spleen. It may be congenital or by birth the spleen is non-functional, or it may be the result of a trauma or accident in which the splenic injury has occurred or splenomegaly has occurred and the spleen is unable to perform its task. So this condition is called asplenia, and again in this condition splenectomy is recommended. The surgical removal of the spleen from the body is recommended because it is no longer functional. So this was all about the structure and function of spleen and the important conditions of the spleen.